May I come in?
Yes.
Hi, my name is Allison, and today I'll be a nursing student.
Okay.
Can I have your name?
Paige Anderson,
Can I have your date of birth?
3/20/95.
Okay, do you know what hospital you're at?
Detroit Mercy.
Do you know what floor you're on?
2.
Okay, there are no obvious signs of illness. Her speech is appropriate. She is oriented ×3. Patient mood is pleasant. Her skin color is appropriate for her ethnicity. So skin temperature is warm. There are no parasites or lesions in it. There are no parasites in the hair. There are no lesions on the skin or signs of skin integrity. Hygiene and grooming is appropriate. There's no drooping. Can you smile for me? Can you frown for me? Can you puff your cheeks? So cranial nerve 5 and 7 are intact. Do you have any pain?
No.
So patient has no pains. Do you have any allergies?
No.
Allergic to latex?
No.
Okay. Next I want to check the eyes. So pupils are dilated and they're equal. Can you follow my pen light? Okay, so pupils are equal, round, reactive to light and accommodation. Conjunctiva is pink. The sclera is white. Okay, next I'm going to look inside your mouth. Could you open your mouth for me? So tonsils are +1. Can you say ah? Uvula is active. Mucous membrane is pink. Uvula and tonsils are pink. Teeth are white. There are no signs of caps or fillings. No bleeding from the teeth or the gums. And hygiene is good. Next I'm going to check her carotid pulse. So the carotid pulse is +2 bilateral. There's no jugular vein distension. Okay, so no signs of brewing in the carotid pulse. Okay, next I'm going to take a look at your arms. So the skin color is normal for ethnicity. Skin temperature is warm. There are no lesions or abrasions or signs of skin integrity. I'm going to check the brachial pulse first. Next, the radial pulse. The brachial pulse. And the radial pulse. So they're +2 and they're equal. Capillary refill is less than 2 seconds on both hands. There are no signs of clubbing. Next, can you shake my hand for me? So patient passes hand grasp test. Next, I am going to listen to the lungs. In 10 places. Every time I place my stethoscope down, I need you to take a deep breath for me. So there are no adventitious sounds in the lungs. I'm going to check the pulse vertebral. Any pain?
No.
Okay. Spine is aligned. The anterior posterior ratio is 2:1 on both sides. Next, we want to check the heart. aortic, pulmonic, herbs, tricuspid, mitral, and I'm gonna listen to 1 minute at the mitral site. Then I'm gonna flip it over to the bell and go back up. Tricuspid, herbs, pulmonic, aortic. Okay, so no abnormal heart sounds or signs of murmurs. Okay, next I am going to check the lower extremities. Lower extremities are warm. There are no signs of abrasions, lesions, or skin integrity. I like to check the popliteal pulse. Popliteal pulse. And check the dorsopedis pulse. The tibialis pulse. The dorsal pulse. The tibialis pulse. Patient passes Verbinski test. No signs of edema in the skin. Edema or swelling in the feet or the legs. Can you lay down for me? So the contour is flat. Next I'm going to listen to her abdomen. Left upper quadrant, left lower quadrant, right lower quadrant. Any pain? No. Okay, so in the there is tympanic sound over the intestines and duodenus over the liver. In the right upper quadrant, you have the liver, the gallbladder, the kidney, and the pancreas. In the right upper quadrant, you have the stomach, the spleen, the pancreas, and the kidney. In the left lower quadrant, you have the ovaries and the ureter. In the right lower quadrant, you have the ovary and the ureter. And then in the middle, you have the intestines. In the right upper quadrant, along with the liver and the gallbladder, you have the ascending. In the left upper quadrant, you have the transverse, and then in the left lower quadrant, you have the descending colon. Can you stand up for me? Can you close your eyes? Can you open them? Any signs of dizziness? Can you walk over there? Can you walk back? Okay, any signs of dizziness? So patient passes Romberg test.